Good morning to all. I thank for the opportunity. I thank DPH for giving me the opportunity. I am not a good speaker, but same time want to give a good statistics about the studies carried out by at a national level, NNMB, CNNS, LFHS, all this one. The title is addressing the triple burden of malnutrition, key strategies and solutions. As you are aware of that, nutrition is very much important. Proper nutrition is the essential for growth and development, sustenance and surveillance, and same time the well-being of the human being. Keeping in it view, our constitution also keep in its article 47 that it is the state's responsibility to look after the health and nutrition as well as the standard of living of its population. In this direction, it has launched the National Food Security Act 2013, where it aims to improve the food and nutrition security of the population by providing adequate quantity of quality food. Same time, it has also launched in 1913 as a National Nutrition Policy, where it has two components. One is to address the short-term interventions, where it addresses the safety net programs by focusing on the vulnerable groups, particularly adolescent girls, under 5 children, pregnant women, and lactating mothers. Same time, the second part is the policy interventions by women empowerment, women literacy, land seedling act, all these one to address this persistent problem of malnutrition in India. All of us are aware of that. In this direction, it has launched the TPDS system, where 75% of the rural and 50% of the urban population are receiving the supplementary food grains through TPDS. All of us are aware of that pregnant women for children, there are several supplementary nutrition programs. There are 8 national nutrition programs. First 3 are addressing the micronutrient issues, vitamin A deficiency, iodine deficiency, and iron deficiency. Whereas the rest of them are a supplementary feeding program, initially to meet the protein and energy requirements. In spite of all these measures, where see our, as per the Human Development Index, where we are faring very poor, where our rank is 134. Similarly, as per the recent JAMA network, this one, about 19.3% of 6 to 23 month children are suffering from zero hunger, which means that the previous days, these children have not consumed any milk or solid or semi-solid foods. This is very pathetic. Same time, about 1/3 of the global standard children are living in India. This is also not good news for us. Same time, you can see our global hunger index. For global hunger index, we need 4 parameters. That is proportion of the under 5 child mortality, proportion of stunting among under 5 children, among proportion of wasting among under 5 children. These 3 parameters are nutrition parameters. The 4th one is the proportion of the population consuming the calories, adequate calories. In this one, we are faring very poor. Our rank is 111 among 125 countries. This is very poor. Same time, we are not anywhere closer to the SDP targets by 2030. Still, we are faring very poor in this regard. This malnutrition is, there has a reason. As for jellyfish and jellyfish recommended, there has 2 influences. One is the condition influences, which includes the infectious diseases as well as poor personal hygiene. Whereas the other conditions are cultural influences, where family plays very important role because our dietary habits or dietary pattern are dependent on our family. Suppose you are born in any vegetarian family, you used to take very vegetarian diet. If you born in non-vegetarian family, you used to take very non-veg diet. That's why our food choices are not by our choice. It is by chance we are forced to take based on our family pattern. You can see that there is some religion and food patterns, several things are placing role in persistent problem of undernutrition in India. So today's topic is the triple burden of malnutrition. There are three parameters, three epidemiological transitions which are causing the triple burden of malnutrition. One is the nutrition transition. It is a shift in the dietary pattern of the population, food patterns, consumption pattern, and energy expenditure. All these are associated with the, what is this one? The globalization and urbanization. There is tremendous impact of all these on food transition. The second one is the epidemiological transition, where the disease burden is shifting from the infectious and undernutrition to NCDs, which are obesity and related NCDs. The third demographic transition there is a large shift in the population structure, where there is a wide base of youth to more rectangular face of elderly population. You can see this one. The first one you can see, this first one in the developed countries. Earlier we are like this. Now the 60 plus population are, the shape is bulging. As you are aware of that the elderly population are more prone to develop NCDs because of their longevity. Now I focus on the hidden hunger. Hidden hunger is not an invisible one. In the spectrum of the triple burden malnutrition, the extreme left side there is undernutrition, infection disease, whereas the right side is overweight, obesity. In between, invisible thing is the hidden hunger. That is multiple micronutrient malnutrition. We can see the visible things as the clinical manifestation. Only we can compare it to the iceberg phenomena, where only 10% of the cases are visible to the naked eye. When the physician is examining physically, only we can see only 10% of malnutrition which are manifest in the form of clinical signs. The rest of 90% are not visible. It's submerged portion. We can detect it only through estimation of blood estimation or dietary surveys. You know, these are the important micronutrients where India is facing problem in respect to hidden hunger. You know, all of us, these are the challenges, or you can call it the causes. What are the causes? Indian diets, our experience shows that NNB surveys, periodic NNB survey, diet surveys, our diets are only monotonous diets. Only our plate is full of cereals and cereals. Very few things which are vegetables and other vitamin, other multiple micronutrient rich foods. At the same time, in India, it's a low intake animal diet, animal source diets. Because you know the animal source diet, we can get it heme iron and direct vitamin A, other important micronutrients, as well as bioavailability also very high in animal source foods. But animal source foods are very low in India. Exclusive breastfeeding for the first 6 months is very poor. Only 45 to 50% around people are consuming exclusive breastfeeding. And there is a delayed and faulty complementary feeding practices. All these are contributing to the micronutrient deficiencies. These are some of the NNB surveys where you can see the 1 to 3-year children. The rights are nutrients. You can see the RDI is the requirement, whereas the actual intake in urban, rural, tribal children. You can see, for example, calcium requirement for 1 to 3-year children is 500 milligrams. Actual intake is 95 grams. In tribal children, 166. In rural children and urban children, 270. They are not meeting even 1/4 of their requirements. If you take the vitamin A, the RDI for vitamin A is 390 micrograms, whereas the tribal children are receiving only 32 micrograms, rural children 61, urban children 41. Even urban children also not meeting the requirements of vitamin A through their diets. You can see in the pictography graph, you can see the deficit intake. Deficit intake of nutrient. What are the major nutrients that are deficit through diet? Calcium, iron, vitamin A, riboflavin, vitamin C, total fat. These are the pictures. This deficit is almost in the all age groups. You can see this finding in almost all age groups. This is with respect to 4 to 6-year children. We can see the same trend of intakes. Suppose the total folic acid among 4 to 6 years we require 135. But actual intake is only 26 milligrams. and 72 in rural, and 111. Even urban children also not meeting the requirements of RDA, daily RDAs. This is the pictograph. Except thiamine and niacin, all the major nutrients are deficit in the diets of the 4 to 6 year children. This is the deficit intake of nutrients 7 to 9 year children. You can see the similar picture in entire age groups. This is 10 to 12 years boys. It is 10 to 12 year girls. Compared to boys, the iron deficit is more high. Compared to the boys, in the girls, it is very high. This is with respect to the 13 to 15 year boys. Almost our same pattern is we can observe across the all age and physiological groups. This is with respect to 13 to 15 year girls. This is deficit, huge deficit. We cannot fill it by only the dietary approach. What is the common practice? What is the general is? It should be a diet approach. Through dietary approach, we cannot meet, nowhere we are not closer to the anywhere to meet our daily requirements. That's why we have to adopt supplementary fooding programs and other fortification measures. Otherwise, we cannot meet our daily requirement. This is 16 to 17 year age children, the girls. It is a pregnant woman. You see, in a pregnant woman also, the deficit is very huge, particularly with respect to the vitamin A, iron, folic acid, and calcium. This is the lactating woman. In everywhere, the intakes are very low among the tribal population, followed by rural population, next urban population. Even urban population are also not consuming the adequate intakes of their requirements. You can see as per the NFHS file, more than 50% of all age groups are suffering from anemia. It is with respect to undernutrition and overweight obesity. You can see this one, underweight, as per the NNM urban survey, and 1/4 of children are suffering underweight. At the same time, 4.3% are overweight obesity. But in rural surveys in 2012, about 42% of children suffering from underweight. With respect to the same figure, with respect to NFHS 5, about 32% are suffering from underweight, and overweight is 3.4%. This is less than 5 children with stunting. You can see about 29% of urban children are still suffering from stunting, whereas it is 43% rural children are suffering from stunting. The stunting proportions are 35.5% in urban NFSS survey, whereas wasting is 19.3. One trend is observing, the underweight and stunting are gradually improving, where in case of stunting, wasting, it is gradually increasing over a time. This is with the adolescent age groups. You can see the prevalence of thinness, one side thinness is there, one side overweight obesity is there. You can see this one, there is a strong association with obesity. If the obesity increases from lean body to obesity, the prevalence of diabetes also increasing. Diabetes, overweight obesity is contributing 42% of the diabetes in India and 20% of ischemic heart disease, and 7 to 41 different types of cancers. This is as NNMS study, National Non-Communicable Monitoring Survey conducted by NCDR of Bangalore. You can see the prevalence of overweight obesity, where the BMI is more than 25. You can see the highest prevalence of overweight obesity as reported in the Rajasthan, followed by Puducherry, Tamil Nadu. Tamil Nadu overweight obesity and adult population men is 38%. The lowest will be reported in the state of West Bengal. It is with respect to adult men. Whereas with respect to, this one, women also even more. Compared to men, the overweight obesity is even more among women. It is waist circumference, where we consider as if more than 80 centimeter in women and more than 90 centimeter of waist circumference in men, we consider as the central obesity. We can see in urban area, 58% of the women are had a central obesity. Overall, in a total obesity, 41% of women are this one. In India, it is a central obesity. You can see the childhood obesity also. As per CNN survey, about 4.8% of children are suffering from overweight obesity. Now you can see that what are the consequences of this one. The consequences are impaired brain development in children and low IQ, whereas low birth weight, weakened immune system leading to increased risk of NCDs and infectious diseases, premature death, low productivity, risk of NCDs. At the same time, 45% of under 5 mortality is attributed to undernutrition. You can see the consequence of overweight obesity. These are the all consequences related to overweight obesity. Strategies are solution. Sorry. FAO WHO recommended 4 strategies to address this micronutrient malnutrition. First, we in the dietary approach. Through dietary approach, we can address the micronutrient malnutrition. The rest of 3 there are supplementation, food fortification, and public health measures. But as I said, the dietary approach is the appropriate one. But we are nowhere. We are there to the addressing our micronutrient malnutrition. That's why India, the NIN recommended recently the My Plate, where we have to consume balanced diet to meet our this one. What is balanced diet? There should be you should try to include a majority of the food groups in your plate so that you will meet the daily requirements of your nutrients. That's why what is that minimum dietary diverse code should be 5 and about. Among 8 food groups, there should be minimum 5 food groups in your plate. Then only you can be able to meet your daily requirements of nutrients. Second one is all of us those supplementation programs. In India, there are several supplementation programs. What are the vitamin A supplementation, iron supplementation, other iodine fortification, all are supplemented. For second intervention measure. For third one is the fortification. Fortification, the government of India recognized this one because of anemia is a major problem and it persistently very high number across all age groups. That's why the fortified rice is the one of the intervention where we are now through PDS and midday meal ICDS they are implementing this one. The fortification, it has a clear-cut impact fortification. You can see the forest plant where majority of the studies indicate that iron fortification can improve your hemoglobin levels. Whereas iodine fortification can improve your median urinary iodine levels. Other one is the multiple micronutrient fortification. All this Horlicks and other things, people are using different type of beverages where they are fortified with multiple micronutrients. Fourth one is the public health measures. Unless you address these public health measures, you cannot address the micronutrient malnutrition. That's why personal hygiene, control immunization, infection through immunization, other public health measures, particularly using the WASH program, you can address this problem. These are the strategies recommended by meta-analysis where you can, from the childhood obesity can be reduced by increase the fruit and vegetable intakes, reduce TV viewing, encouraging physical activity among the children, and eating healthy behavior among children. It is over. This is my last slide. Points to be remembered. What is adopt a healthy lifestyle and food habits to address all these undernutrition, hidden hunger, and NCDs among the population. What are they? Eat healthy and maintain the appropriate body weight and your body mass index, so that to address all the issues and include more food groups in your daily diets. You take minimum 5 food groups. Whereas our Indian plate, what as usual Indian plate is 90% of the plate is only cereals and cereals, rice or wheat. Very low portion is we are giving the importance to the micronutrient rich foods. Consume variety of fruits and vegetables and pulses because our fruit consumption is very low. Fruits are very rich in micronutrients. Regular brisk walking or other physical activity 30 to 45 minutes per day is essential to address all the NCDs problem. Minimize the high fat, salt, sugar intake, HFSS. FSSI also stressing more on this issue to address this issue. And avoid eating the ultra processed foods. Same time, avoid the combination of consumption of carbonated drinks, alcohol, give the alcohol, moderate alcohol, and smoking. Focus on primordial prevention, where healthy lifestyle should be adopted through childhood, adolescence, so that you can prevent the NCDs in the adulthood. Thank you.
Thank you, sir, for briefing us regarding the triple burden of disease, that is underweight, overweight, as well as the hidden hunger, that is macronutrient malnutrition. We know that NIN is contributing a lot to the country by ways of research, and there is a way forward to tackle this in our state also. Hopefully, we will also commit towards that elimination in the near future. Thank you, sir.
We request Dr. Cheran sir, Director, Institute of Community Medicine, Chennai, to felicitate the speaker. Thank you, sir. We thank JDCD sir for moderating the session.